Hey everyone, and thank you so much for tuning in to another episode of The Pulse. I am here with
Cornelius Bankston.
All right, and Cornelius, can you tell us a little bit about yourself and what you do?
So I run TechPlug, which is a health innovation firm located in New Orleans. We work to address health access in vulnerable and marginalized communities.
Can you tell me why that's so important?
Well, when you think about where we are as it relates to chronic diseases in our communities, we rank at the bottom. And so we're really passionate about finding entrepreneurs that have innovative solutions that can reach people where they are.
Yeah.
That's why it's so important to us. We need innovative health tech solutions to reach us in our community.
Yeah, absolutely. And can you tell me what it was that kind of helped you create this idea? And what are some of the things that you're seeing, or are you already seeing improvement?
Great question. I'm going to give you the short version.
I want the long version.
Okay, I'm about to give you the real. At least I'm pulling my earlobe.
You got time.
Let me tell you what the real is. So the long story short is I worked in business development for years, right? And I saw that there are incredibly smart people in places like Cambridge, in Massachusetts, from Harvard to MIT, out in San Francisco, amazing people doing amazing work, but they wasn't doing work in the communities that I cared about, Black and brown communities, and getting those solutions to them in an effective way. And so that's the name Tech Plug. So we the tech and the plug to the community. That's why we started this journey. It's because we saw an unmet need in communities that we care about.
Absolutely. And so I feel like a lot of people are now trying to get into their entrepreneurial bag.
Yeah.
They want to do what you're doing. So how can they kind of start to step into that space? And how do they even recognize what they're passionate about? I can't ask you that, but how do they recognize where the need is and build their creation based on that?
Oh, wow. That's a loaded question. Because I think you can take it from two different sides. As Black people, just go back home and sit with mama and them. Where they suffering from? Sugar, diabetes. And so thinking like, what could work for my grandmama? Because grandmamas, we all got grandmamas. Hopefully we all had grandmamas or granddads that might be suffering. We might have parents or siblings suffering from it.
Yep.
And start thinking creatively around how can we get a solution to meet them where they are? So start at home.
Yeah, absolutely.
Yeah.
And then that also makes me wonder, why is it so important to bridge tech and Black health?
Just think about the moment we're living in. We're talking about AI, artificial intelligence. We're thinking about, machine learning. We're talking about recognition of computers can identify our melanated skin. So if we're not in those conversations or at the table to help drive those changes in technology and innovation, we're going to be left out or behind. So it's incredibly important for people who might have a passion around solving problems to get into this space so that we can solve the problems for the communities that we care most about.
I totally agree. And I think especially when it comes to tech and healthcare, or healthcare in general, and Black faces, Black skin, we tend to be left off the docket. We're not a part of the groups or the focus groups. We're not a part, our voice isn't heard.
Yeah.
So I'm really, really grateful that you are doing things like that and helping others do things like that.
Yeah.
So for someone who is looking for your platform, first of all, where can they find you?
www.techplug.tech.
Okay.
Or you can find us on Instagram at techplug.tech.
Okay. And if they're looking for example, this is actually an entrepreneurship question.
Yeah.
So I'm going to ask you a couple of those too.
Yeah.
How do they get funding for something like that? Or how do they get, I know that's a gem.
Yeah.
What is it?
So it's a lot of different ways.
Okay.
What we're seeing now, grant dollars, we're in DC. So federal grant dollars within this space is drying up, to be honest with you.
Oh, wow. Okay.
It is. And so what we have to become is creative. The thing about Black folk that we do is we'll take the worst part of something and make it a delicatessen. We'll take the worst part of a pig and make it a delicatessen. So in that is like, how do we get creative around funding? Okay. So do we do small crowdfunding opportunities within communities that we care about? Or do you find physicians that might have extra dollars to support your endeavor? That could be a way. But there are sources from like non-dilutive funding, like Camelback Ventures is one. I don't think it's non-dilutive, but there are opportunities out here where people are funding early. These are early stage companies. These are people like, I got an idea. I don't know if it's going to really work or not.
Yeah.
And so you really depend on family and friends to help you over that.
Yeah.
And if you're in a research setting, there might be some research dollars from like a research institution.
Yeah.
It's a very complicated, complex question.
Yeah.
But email me and I can get you some more intel.
Absolutely.
Yeah.
And then I know that a lot of people are concerned about kind of diving into the healthcare space, especially when it comes to diversity, since we are seeing a lack of focus or a dry up, as you said, in DEI. So do you still think it's a good time to even dive into this space, and why so?
We need black, brown, yellow people in this space, because what we see is when you go to the hospital, you just don't see white people. You see black people, you see white people, you see all types of people. Just because the conversation is changing here from a political perspective, that does not mean on the ground that the work still needs to happen. So we still need people from all backgrounds, from all socioeconomic perspectives to be engaged in this conversation, engaged in this work, because where we are, like we had this conversation around personalized medicine. And do you know what personalized medicine is?
Tell me about it.
So it's really around medicine meeting you where you are, based on your genetic profile, based on how you live. That's where we're going as it relates to medicine and innovation. And so if we're not at the table or if we're not represented in these spaces, how are we going to have solutions that's going to be personalized to our genetic makeup? We won't.
Yeah. Absolutely.
Yeah.
Well, I want to thank you so much for your time. Before we go, if there was one thing that you really wanted people to grab from this interview, what would it be?
Oh, wow.
Or even if you have something new that we didn't touch on, what would it be?
This is, I think, leaving this conversation is take the leap of faith.
Okay.
Whatever that might be.
Yeah.
Write a book, go to medical school, no matter what age you are, go to that PhD program, start that company. Yeah, take that leap, because your leap is connected to somebody else's why.
Yeah.
It really is.
I love that. I love that. Well, thank you so much for joining us on this episode of The Pulse.
Yes.
Hope to see you on us again soon.
All right. Thank you for having me.